An eating disorder initially gives you a sense of control and mastery. You often initially also get positive comments from others about how disciplined you are and so on. So this is then the perfect segue into an eating disorder with this general sense of uncertainty, upset, stress, all these difficulties that people have had, the social isolation. The eating disorder may then have seemed like a solution to that, but of course it doesn't stay like that. It then becomes habitual and compulsive. The physical negative effects start setting in, poor concentration, feeling tired all the time, and all the multiple physical consequences that eating disorders have. It becomes an overwhelming preoccupation, and people say my whole mind space is taken up by thoughts about what I eat, when I eat, how I eat, whether I've eaten too much, should I have had an extra portion of salad or not, was this yogurt too big, and it drowns out everything else in the person's life. And people often find this very, very distressing and notice themselves that really they have very little bandwidth for other things. My name is Ulrike Schmidt. I am Professor of Eating Disorders at King's College London, and I'm also a consultant psychiatrist in the Eating Disorders unit at the Maudsley Hospital. I think the link between the pandemic and eating disorders is quite complicated in the sense that the pandemic has been very traumatic and upsetting to all of us, to all human beings. And we know that mental health problems in general, anxiety, depression, distress, have risen in the population. And we also know that young people in particular have been affected. So what we have seen in eating disorders is a sort of 20-30% rise in new cases. And this is in adolescents, but also in young adults. And if one thinks about it, it is because the social worlds and the educational worlds of these young people have been totally turned upside down through the pandemic. So people not being able to see their friends, not being able to go to school, exams being cancelled, university being online, those who are working being put on furlough, losing their job, people who'd left their parental home having to move back in with their parents, and all the stresses that all of that brings then has made some people more susceptible to an eating disorder. And again, if you think about it, what we hear on the news is we hear about people putting on weight during the pandemic. On average, I think in the whole population, it's been about 5-6 kilograms, about a stone in weight gain at population level. So if someone who perhaps already was a bit concerned about their eating or weight at the start of the pandemic, they might have tried not to just sit at home in front of the computer. They might have gotten into trying to be particularly careful, to exercise more, and then gradually slid into this. I don't think it is just that people are more aware of their difficulties. I think there's been a genuine rise in new cases. And what we're also seeing is the people who are presenting and have presented throughout the pandemic are not milder cases. They are as severe as the cases that we normally see, suggesting that the pandemic-related stresses have really unlocked something in a group of young people who are under tremendous stresses that then takes on a life of its own. Well, one thing that we have also seen during the pandemic is the pandemic has made us much more aware of health inequalities for young people from minority ethnic groups, but also inequalities in terms of males and females, inequalities for young people from the LGBTQ plus community. And we are really aware, and there's research out there showing that all these people from different minoritized groups find it harder to get access to treatment and get the treatment that they need and deserve. So we are working on a big research project called Edify that looks specifically at routes into eating disorders for these different groups that are often quite disadvantaged in their help seeking and treatment journeys. There might be different reasons for different groups, and I suspect it's quite complicated. But for some groups, it might be to do with not trusting the health services particularly. For other groups, it might be something for cultural groups where you think it should be kept in the family and the family should sort it out, those sorts of things. It may also be to do with doctors not recognizing eating disorders as much in young people from different ethnic groups compared to white majority culture, based on the stereotype that anorexia traditionally was always thought to be related to white, more privileged backgrounds, although we now know that eating disorders occur across all social strata. Well, it's come out in the pandemic partly because of Black Lives Matter, but partly also because of people then realizing that COVID infections, COVID deaths, and all of that affected certain minority groups more than others, that this often was also linked to issues around weight, and so then it's only a small step to also think about eating disorders. BMI is a very crude measure, but at the same time, knowing whether someone's weight is going up or down does give a bit of objective information, but it shouldn't be sort of seen as tablets of stone. Yeah. So in many places, most places, people would have to go to their GP first to get help. This can itself be quite difficult for young people, especially if they're on their own. They may not know what to say to the GP. They may feel a bit silly to go to the GP. They may wonder, will they just turn me away? Are they going to say I'm not severe enough? All those sorts of things. Beat on their website have a help-seeking page, and as part of that, they also have a really useful resource on how to talk to your GP and what questions to ask your GP, what to say to them. And you can even give a leaflet to the GP on, I think I have an eating disorder, and asking the GP to do certain things. So that's really helpful, especially if you think you might get a bit tongue-tied and don't quite know what to say to the GP. The other bit of advice would be to take someone along with you who you have spoken to before, a friend or a family member, who can speak for you and who can add to your own story with the GP, so that you take the dauntingness out of that first meeting. The GP then will often refer you on to a specialist service, such as our service. There are now specialist services up and down the country. And most services now have an early intervention part to their service for young people with eating disorders. The early intervention model that we've developed, which is called FREED, or First Episode Rapid Early Intervention for Eating Disorders, is being rolled out all over the country. So this is to ensure that young people who present with an eating disorder get speedy help that's personal to them, where the care is well coordinated and that they really get the best available treatments as soon as possible.